Well, 2 minutes after the top of the hour, which seems like a good time to get started. So, hello, everybody. I'm Will Snyder. I'm the co-founder and CEO of Metopio. Very excited to be joined by colleagues from the Louisiana Public Health Institute today, Haley Alexander and Taslim Van Hattem. And we're going to dig into some pretty exciting topics on data collaboration, data sharing, and so forth. But ladies, if you'd like to say hello first, we pull up our slides, we can jump right in.
Hey, good afternoon, good morning, wherever you are. I'm Haley Alexander with LPHI. Great to be here.
Thanks, Taslim.
Again, good morning and good afternoon to folks. Taslim Hattem, I'm a Chief Program Officer at the Louisiana Public Health Institute, and excited to spend some time talking about data and collaboration and exciting things in the future. Well,
Excellent. Well, thank you both for being here. We all were together last month. Hard to believe, back when summer was still in full steam, for a public health infrastructure grant convening in St. Louis, and talked about some very similar topics. And we thought it'd be fun to get the group, put the band back together, and really touch on a few themes today. So thinking about that infrastructure piece with data modernization, something that we're very excited about at Metopio, and we think LPHI is doing really well, is the data collaboration and shared services between jurisdictions. As always, we like to focus on workforce development and workforce training. We, especially at Metopio, are very much involved in integration of generative AI into our solutions, but really as an assistant, and don't like to think of these things as, the job killers or replacement. This is a huge opportunity to just improve the efficiency with which we can work and what we're able to do, especially with data. We'll also touch on just how we can further engage the community, especially with an equity lens. And hopefully with all of this, you'll leave with some actionable insights you can start with today. And as we see your answers for your current approach to data sharing, kind of a wide range, but a small majority has regular but limited sharing, so only to some partners. So hopefully everybody can come away today with some ideas for how to improve that, how to make it more efficient, and also how to articulate the value of data sharing. So with that, Haley and Taslim, I'll turn it over to you to kind of talk through what LPHI is doing, and then we'll dive into a little bit of Q&A towards the end.
well, great. Well, thanks so much. And really excited to be in conversation with folks today, both on the line and then folks across the country. The Louisiana Public Health Institute is a statewide community-focused nonprofit. We're grounded in Louisiana with our headquarters in New Orleans. And we also have a pretty large-scale footprint across the Gulf Coast, and then with different healthcare organizations and systems across the country. We're committed to ensuring that all Louisianans have fair and just opportunities to be healthy and well, and we really operationalize that through a number of different ways. As you can see here, a lot of work around analytics and data translation, monitoring, evaluation, and learning. Significant amounts of public policy and advocacy. And then in the day-to-day, we implement between 50 to 100 public health-oriented programs across the state and Gulf Coast annually. Topically agnostic, but deeply rooted in some of the topics that you see here related to community engagement, behavioral health and wellness, maternal and child health, and then, of course, addressing chronic disease, for example, as well as prevention within tobacco prevention and control. Go to the next slide.
Yep.
Overall, LPHI offers a pretty wide suite of data infrastructure and support services. We have a multi-pronged data hub, and we'll talk a little bit about this in a few different ways and then how we've really operationalized it over time. But Louisiana, or LPHI, houses the Louisiana Clinical Research Network, or ReachNet, which I'll talk a little bit more in depth in a second. PELEX, which is a health information exchange. And then we have a dynamic monitoring, evaluation, and learning team that facilitates data collection on the ground and in communities, as well as supports quality improvement and assurances, particularly around the public health programming that we engage in. And then through that public health lens, really looking at our data across care coordination, informing community funders and other partners, and then really looking at data to address the social determinants. Next slide, please. So as I talked about, we are one of 8 clinical research networks called ReachNet, and that is one of those 8 clinical research networks in PCORNet, which is the National Patient-Centered Clinical Research Network, and we are a coordinating center. ReachNet has or houses about 16.8 million patient records, where we utilize those records to enable the conduct of multi-site research, really enhanced with efficiency in real-world healthcare delivery systems. And then the most important thing to know about that is much of those records, or all of those records, actually conform to the PCOR Common Data Model. Go to the next slide. And I think Haley can talk a little bit about, beyond the research infrastructure we have, how we look at, collect, and utilize data in real time. Haley?
Thank you, Taslim. So PHIG is a health information exchange that LPHI runs, and it primarily serves Louisiana's Medicaid population. It has been around for over the last 10 years, and PHIG's mission is to promote high-value, well-coordinated care to ensure that everyone has fair and just opportunities to be healthy and well. The first time that we did this panel, Taslim had such a great example of leveraging or sort of providing that real world use case of health information exchange. So I'll walk you through that same experience, and it'll sort of showcase how it impacts the patient, providers, and Louisiana as a whole. If I were to walk into the ER for having some medical episode, and maybe I need to follow up with a primary care physician afterwards, my primary care physician would get a notification that I have been in the ER and are told to follow up within the next couple of days. I would then get a notification on my chart reminding me that I should follow up with care. This is when I should be scheduling an appointment and what type of provider I should be scheduling an appointment for. I would then go to that follow-up care. If there's any additional need that needs to be taken after that follow-up appointment, different providers would be notified to really center and focus that whole person care and ensure that people are getting the care that they need when they need it and with the providers that they need as well. So we'll go on to the next slide, and I'll pass it back to you, Taslim.
Great. So I think a little bit of the examples that both Haley and I talked about are really that LPHI believes not in collecting data for data's sake and being a repository, or I would say a static repository of that data, but really looking through that public health lens of how data lends itself to action. Right. So we talked a little bit about the ability to leverage data for clinical care coordination in real time to really impact folks' daily experiences within healthcare access. And then I talked a little bit about our capacities within helping shape patient-centered research across the country. Utilizing some of that core infrastructure, we've also taken the opportunity to create something called the Louisiana Maternal and Infant Data Collaborative, which is a data collection and analysis system that aggregates information from participating health systems to study maternal and child health outcomes in Louisiana. This is one of those key examples of we don't own the data, but we really intentionally steward the data to both support research as well as clinical care outcomes in the long run within our community. So this is a great example of innovative ways to look at data and take available data in the New Orleans context from 1 year pre-pregnancy through 1 year post-pregnancy, looking at about 160,000 pregnancies and 124,000 unique birthing persons, and then being able to link that to infant records and use that linked data to really analyze disparities in everything from pediatric care utilization to preterm births, to really think about how we are starting to address maternal mortality and poor maternal and child health outcomes locally, most particularly when we start to think about the ability to utilize our local data to drive both research, but also inform programs, improve quality of care, and then reduce larger adverse outcomes within healthcare. So a lot of this is really about connecting those larger data systems and the data stewardship into really lived examples of how this informs both the research and the outcomes. I'll go ahead and go to the next slide and maybe turn it on to Haley to talk a little bit about how we take that information in a few other ways to really link it back to monitoring, evaluation, and learning through our assessment.
Yes, thank you so much, Teslim. LPHI sees ourselves as an assessment coordinating center across Louisiana and the Gulf South as a whole. And within this, we see the mission is really convening partners and aggregating data and leveraging this data for collective impact of health outcomes from providing technical assistance and leading the primary data collection components of community health needs assessments, community health assessments, and then supporting the development of improvement plans as well. LPHI leads a monthly working group to promote alignment across entities working with or interested in assessments and improving plans. Currently, this group has over 30 partners, inclusive of state and local government, hospital systems, universities, and foundations. LPHI has completed community health needs assessments for over 30 unique hospital facilities across Louisiana and Mississippi. And this is also inclusive of joint assessment and improvement plans. And we're really proud of the collaboration that we have fostered across partners to conduct these. And some of the services that are included within the assessment package include peer networking, ensuring that all of the assessments meet IRS or accreditation requirements, partnerships with community-based organizations to build trust and really lean into that authentic community engagement, as well as leading community surveys and sampling techniques. And then finally, surveillance of improvement plans with patient health outcomes, and really seeing how we can leverage those data to support greater in improvement across the state and the Gulf Coast. So you can go on the next slide.
Great.
And well,
this a bit more. I think what's so great about the work you're doing is taking really complex data systems and integrating them in a way that multiple people can benefit from seeing that more holistic view. And again, that's, we like to think about technology as being able to compose a narrative and empower people to make better decisions for themselves and also for their communities. For those of you not familiar with Topio, we are very much purpose-built for public health and community health work. So we focus on kind of 5 key areas: data collection, data organization and management, analysis, visualizations and report building, and then data dissemination. All of that works within our platform. We focus heavily on curating data and data quality and data governance, and do a lot of work in automated workflows around community health assessments and community health improvement plans, and are very much thinking about how this work aligns with the big public health, the current public health agenda around data modernization. So those linkages between data systems, the workforce capacity, like we spoke about earlier, and then really trying to foster a sense of collaboration, insights. Something that we're working on this just in the data integration space, I'm excited to give everybody a little bit of a glimpse of it today, is what we've been able to develop through a new data model. And this is letting users now work with line level data, such as surveys or claims data, and be able to query that data directly via a chatbot. And what this chatbot is doing is taking a plain language query and turning that into essentially what we call text to SQL. So it's taking the plain language and then writing SQL code. And in this case, it's looking at an actual survey. So we're asking, what are the top health concerns, or dummy data, but it's survey data that it's running on right now. Who are the survey responses coming from? What are the top community issues? And then the distribution of those issues. So being able to very quickly work with data like this, we think is a huge opportunity in the community health improvement space. And excited now to pivot to a Q&A, but really kind of setting that up around CHAs and CHNAs 5 years ago, 7 years ago, were very heavy on kind of looking for secondary data, doing ETL work on that data, then maybe trying to get a few focus groups done, but there's the bandwidth always became a challenge. But now we're at a point where we can really start to think about lots of clinical data integration, community data, and putting that in an environment where it's very easy to query and analyze. So we've got one quick poll for you before we jump into our discussion. So just kind of curious what barriers your team is facing when leveraging shared data, especially in the assessment and community improvement planning space. And while people are responding, we'll close out our presentation and switch to couch mode for the Q&A, like we're on a talk show. So Haley and Tessie, thank you both for going through some of the great work that LPHI is engaged in. I'm kind of curious on a technical perspective, when you're talking about connecting systems like the maternal and infant example, and then like moving some of those insights into an assessment framework, what are the biggest challenges you all faced in terms of building the connectivity? And then what are the big challenges that your partners faced in trying to get those flows set up on their end?
It's a great question. Well, I can start, and then Teslim, if you want to add on to it at all, please let me know. I think one of the challenges that we face that are really excited to be making great headway on this is that much of the data that LPHI houses through things like the Maternal and Infant Data Collaborative or through ReachNet, they are not generally public-facing data. They are private data that can be queried. And so what we're really working towards is making these data and the outcomes of these data more accessible so that they can be leveraged for decision and policy making, particularly within a space that we live now where there is a lot of data disappearance, or many of the tools that folks would be using to analyze secondary data sources have been taken down. We find it to be really important to be able to share these data that we have with the community so that there'll never be a replacement, let's say, for PRAMS data, but it can be used in proxy of and used to then make those decisions, and also the recognition that now is a time where that hyper-local data is going to be more important than ever and can really be leveraged positively to create meaningful change.
Yeah, Haley, the only thing I would add is really thinking about, depending on who is asking what of the data, there's always just competing needs and priorities. And so much of the work that we do is really in identifying the ways that different audiences and people can utilize the data while staying true to the infrastructure and commitment of, patient-centered research outcomes or clinical care coordination, or really thinking about where research meets community meets healthcare systems. So much of that is in really authentic engagement with both partners and communities to really help them understand what is the data, what it can do and what it can't do, and for who and for what purposes.
Yeah, so staying on that point, I think it's really an important one is the data dissemination piece and sort of data literacy. So how do you all think about that, given the variety of stakeholders that you're engaging with? And how would you recommend public health, especially maybe smaller public health departments, think about resources to help with the data literacy piece and data dissemination?
I think, that's just such a good question. And is so challenging. And one of the things that we think through when we release data briefs is for what audience are they built for, and then releasing multiple iterations so that it can be tailored to who it is, to sort of expand the utilization. So sometimes we may release a very technical brief that gets into statistical analysis and p-values and all this other stuff, but that might not necessarily be the most relevant for community organizers. And then thinking about how do we create one-pagers or documents that can be used and very clear of these are what the data are saying, and this is what it means practically, and then providing those recommendations so that it can build that data literacy a bit more, and make it more translatable. I think another thing that's important is giving it publicity and engaging in things like these webinars, or in coordination with community health assessments for, say, local health departments, is having those community meetings be a large part of the standard process of starting, it's through the health equity data analysis structure, if you will, is the first point of engagement is with community, describing the landscape and sharing some of the data, and then coming back to present any of the additional findings from the assessment itself, and gathering that community feedback and sharing it in a way that is accessible, and taking in that input from the community of what they're trying to see, if it meets their realities, and if not, why might that be the case?
Gotcha. Yeah, I think that's great. And I just kind of looking at this poll result, or poll results, the two biggest issues that our audience today is facing is, workforce capacity and then governance. So I'd like to dig into that second piece. How are you all thinking about and advising your constituents on data use agreements, especially as you think about data, moving maybe between state and local, or public and private?
Yeah. So, in the technical space, we spend a significant amount of time really developing out very strong data use agreements with partners, right? We house data for health systems, both across Louisiana, the Gulf Coast, and actually the country, right? It's not data that is owned by us, right? So a significant amount of, I would say, our infrastructure development over the last 10 years is really the intentionality around data use agreements. And that is, like I said, a significant part of the early on conversations. And that, that's both with our chief data and impact officer, as well as legal counsel on every side. But I think ultimately it lends itself to really strong protections, both for the health system, as well as a lot of clarity on how we get to use data in the future, and how we can really think about future facing data efficiencies. Governance is a really exceptionally critical part, I think, of any form of data sharing and data engagement. But I think with any successful endeavor, really making sure that that's something that you're planning up front is what lends itself to future ease and engagement later on.
Great points. And just want to remind our viewers today, if you have questions, go ahead and put them in the chat. Happy to answer them. And engage the panel with your thoughts. Not just questions, you can also share opinions if you want. So kind of from a practical standpoint or applied data standpoint, what have you seen work with, integrating more complex data systems, or especially like clinical data, into community health improvement plans? How is that evolving, and what are you seeing that excites you?
Couldn't get to the unmute button fast enough.
It's like a game show. Which one of you can unmute fastest, or like which can slap the buzzer?
Not winning that game, but I'm so excited to answer this question. In the sense that over the last cycle of CHDAs that we did for hospitals particularly, but I think this is relatable and important to local governments and state governments who are completing CHAs and SHAs, is that within the last cycle, we saw groups, I know Anne's on the call, hey Anne, that completed a joint chip across the hospital systems. And I think that really promotes that collaboration. And the next step in that is really finding ways to leverage those electronic medical records and the patient health outcomes from the specific patient populations that can help with not just quality improvement and assurance, but also help drive where the focus should be for the chips, so that they can really leverage those 3 years between cycles in the best way possible and understand where might there be momentum, what could that be linked to, and tailor the focus where there are those biggest disparities so that we can try to narrow the gap on those. And so I think one of the things that secondary data does great is shows population health, but it doesn't get to that specificity. And there's also often a lag time. And by using the electronic medical records, you have real-time data that you can make real-time decisions with and see that quick turnaround of where there may or may not be impact. And I think great examples of this is if you're monitoring chronic disease through, say, maybe diabetes or heart disease, you can see that patient engagement and management of care and see those progress in real time. So that's just a quick example, but
No,
I could go on a whole other webinar about this opportunity.
Yeah. I think that's really interesting. And I think that's one of the areas where folks struggle, or we hear some of the biggest pain points, right? Like you do an assessment, population level, place-based level, but your interventions are at an individual level. And how do you reconcile those discrepancies in the types of data and so forth? And I think what you're outlining is really exciting. What happens when they're not necessarily in the system or like necessarily tied into one clinical delivery site or another? So just kind of curious on that tactical piece, and then we'll jump to our final poll, which I think just popped up on the screen.
Yeah, I think one of the things when it's not in the system or in that one piece, it takes a lot of effort from hospital or government staff to pull those data. And I think this is the vast opportunity that data and data efficiencies can create, is that it's not an additional burden on the hospital staff, but it's something that can be generated externally so that the information can be used rather than trying to contact 12 different people from one facility to try to get some data, where the data is now at your fingertips. And with that ease and accessibility, there can be more time spent on actual person-to-person clinical care, community engagement, and doing that work that technology will never be able to do.
Yeah. Well, fantastic. I love it when webinars beget new webinar ideas. So I like this, the digging into EMR data and in your chip is a great topic for a future webinar. So thank you for that. And thank you both, Haley and Teslim, for joining us today. This is a lightning fast discussion on some topics. I think you are doing great work. Great to be able to showcase that and then be able to connect with folks who joined the webinar today on getting into the weeds and the details and the follow-up. So thank you both, first for your great work, and then second for lending us 30 minutes of your time and expertise today.
Thanks for having us.
Thank you very much. Pleasure.
Absolutely. And thank you all. I think you saw the poll for the next webinar. Hopefully you'll join us. And thanks again for coming today. We will have a recording available of this webinar as well as some follow-up materials. So look forward to staying in touch with everyone and hearing about the great work you're doing in your communities. So thank you.